So with that, we are going to move into our first keynote talk of the morning. And I'm really delighted to introduce our first speaker. So just bring you up now. So Jennifer, I'm just going to say, share Jennifer's role. So Jennifer Hough is a policy research officer with Alcohol Action Ireland and develops policy positions around alcohol harm and advocates for change to help protect public health and well-being. So I'm sure she will be well known to many of you and is going to be opening up our conversation today with the paper that she is going to be sharing. So Jennifer, over to you.
Thanks, Ali, and good morning, everyone. It's great to see so many people here today. And just bear with me while I share my screen. I hope there's no hackers going to interfere with our... There we go. Can you give me the thumbs up, Ali, that all is good there? Great, great stuff. So yeah, so as Ali said, today I'm here to talk to you about how COVID has impacted on children and families who are dealing with substance use problems in the home. And I guess this is an issue that Alcohol Action Ireland and I know other agencies in the sector have really been keeping an eye on over the past year and a half since COVID and rolling lockdowns and things, because we know there is a very real concern here. There's been, reports from NGOs, there's been researchers around the world looking into this and some very worrying trends and data is emerging. So I guess what we've done with this paper is brought some of the evidence together from Ireland and around the world. And fortuitously, Barry Cullen in the Dunleary and Rathdown Alcohol Task Force was kind of thinking along the same lines as us, that we wanted to compile this information, bring it together and bring it to a wider audience to really just raise awareness about this issue. So just start off just a little bit about Alcohol Action Ireland by way of introduction. We're an NGO that acts as an expert independent voice for policy change on alcohol related issues. And I guess in terms of children and families, we believe that children should enjoy a childhood free from alcohol harm and that they're protected in their developing environments from the impacts of alcohol related harms. And that includes raising awareness about problem parental alcohol use. So I'd just like to kind of start off again, just to reiterate what we mean when we talk about hidden harm. And that is children who have lived experience of parental problem substance use. And I guess some features of this is that children often aren't known to services and they can suffer harm in a number of ways, I guess, from anything from physical, emotional neglect, right up to the more serious concerns that could be child protection concerns. But I guess the evidence shows that parents who aren't necessarily dependent, but are also heavy or problem or hazardous users, that still can have a significant impact on the psychological and social development of the child. And also just to say that while the stats and information in this report largely do relate to alcohol, the trauma for the family and the young person will be similar, very similar if we're talking about drug use too. So I guess a wealth of research really tells us that parental substance use problems rarely exist in isolation from other difficulties in the family, such as relationship problems, parental mental health, perhaps separation, financial hardship, and right up to those more serious things like domestic abuse and child abuse or neglect. And there's a spectrum of effect again on children and families, and the effects could range from a child withdrawing or underperforming at school, or indeed to acting out. And again, the behaviours can be due to the range of issues in the home, which can range from tension or arguing, perhaps, again, that emotional neglect, and right up to things that can escalate to the child protection concern. But I guess harm, just to reiterate, harm can also be caused when there is no visible child protection issue. I suppose, for example, in a family where there mightn't be other compounding factors, such as financial hardships. So again, it's that real hidden harm, and it can be harder, I suppose, in those families to recognise the harm on the child. And I guess independent research in Ireland does show that large numbers of young people are affected by problem alcohol use in the home. And it's estimated that up to 1 in 6 children are affected by alcohol use in the home. And so really this is an issue that's prevalent in the general population rather than one that's just a niche child protection concern. And research also shows that children are really aware of parental drinking from an early age. So non-dependent parental drinking is also associated with adverse effects like adolescent alcohol use and alcohol-related health problems in later life. And if you can see there, the 1 in 6, I suppose, for children is 200,000 children. And if we talk about the adult population, adult children of these homes, that's at the moment 400,000. So put that all together, that's 12% of Ireland's population. So that's huge. I guess, you know, for children growing up in these homes, the world can be confusing, unreliable, frightening, lonely. There's feelings of inadequacy, low self-esteem, and, you know, these can carry into adulthood. And this is just an Alcohol Action Ireland initiative that tries to give voice to adults. It's called, the overall initiative is Silent Voices, and we've a range of resources around this issue. But we also have a shared voices platform where people can share their stories. And these quotes here on the right-hand side, they're just heartbreaking. You know, you can feel the trauma coming off the page really there. And it's the adults who are still carrying these scars, and you can read them there yourselves, you know, 65 years of age, still carrying the scars of childhood. I lived in fear of my early childhood, and all of these stories have all of these same themes of just adults who never managed to, who I suppose the problem was never recognized when they were a child, and then the trauma carried into adulthood. So that's just just to set the scene that this is an issue that is there and that we've always known is there. But I guess during COVID, we know that there has been a real increase in home drinking, and so that very likely this problem is increasing and being compounded, because, you know, we've been raising, Alcohol Action Ireland and others have been consistently raising during 2020 and 2021 that the amount of alcohol, I suppose, that was being consumed in the home, and that people really did substitute their drinking from pubs and restaurants into the home. And unfortunately, like survey data has shown that in houses with children that there has been reported increased drinking. The CSO found that 27% of households with children reported an increase in alcohol consumption. And a Mental Health Ireland poll also discovered that parents who were homeschooling, 1 in 5 said that their alcohol consumption had increased. So again, for young people, this is all coming with this exposure to this kind of home drinking is coming along with closures for them, access to school, sports, social activities, their peer networks. So we know from other surveys around young people that they are reporting that their mental health has been affected by the pandemic alone, and I suppose the lack of access to their networks alone. And they'll also have been dealing with things that have been going on at home. So yeah, and as yet we don't really know, I suppose, the full extent of that as of yet. And there's also been a real increase in domestic abuse cases, and almost 90% in 2020 of the number of cases dealt with by the DPP. And of course, we do know that research shows that domestic abuse is higher among women whose partners consume alcohol. And the research shows that alcohol use increases the occurrence and the severity of domestic abuse. And of course, children can just witnessing this kind of abuse in the home is just an adverse childhood experience in itself, never mind if they're, I suppose, actually physically hurt themselves as well. So an ERSI paper during 2020 kind of really brought all of this evidence together as well, and kind of very succinctly brought it together and showed that, highlighted that stressors such as unemployment, difficult relationships, extended isolation, perhaps coupled with alcohol or substance use, are likely to affect parental mental well-being. And of course, this is all going to trickle down to the children and the young people in the home. And as I just stated there, we really don't know the true nature of the effects yet, because, you know, studies carried out during the pandemic may not reveal the true nature, as children haven't had a chance maybe to tell someone or to process or to seek you know, someone to tell what's been going on. And again, you know, if they don't get someone to talk to while they're a young person, it can travel with them into adulthood. And I guess just to say, this isn't just an Irish phenomenon. This stuff's been happening all over the world, unfortunately. In the UK, an alcohol survey found that parental drinking had been raising tensions in households, and NACOA, which is the National Association for Children of Alcoholics in the UK, reported a 40% increase in contacts. They have a helpline for young people, particularly who are dealing with parental drinking in the home, and they had a huge increase in young people accessing them. And also in Australia, there's been surveys to show that drinking has increased in the home, and domestic abuse too. So really, it's all the kind of, I suppose, first world developed countries have been showing evidence of this, from Australia to Canada to the UK. So I suppose, like, knowing all of this, we would very much feel that there has to be a response. We have this information, and so, it's vital really that mitigation measures are put in place to address these issues that have caused people distress. And I know that Bernardo's, the Ombudsman, the Children's Rights Alliance have all been calling for the updated national policy framework and Better Outcomes, Brighter Futures to include, or to be, a recovery programme that really puts in place longer term supports and mechanisms to support children's social development, well-being post-COVID. And I suppose we would feel that this would be a place where some supports for children and families around this issue could really come into play as well. And we would be advocating that both targeted and whole of population measures are required for this issue, because, as I was saying, it's not just a niche kind of a child protection concern. And just to give you an example of a whole of population measure in Australia, like I was saying, there was noted to be a very high increase in parental drinking. I guess a survey found that almost 1 in 6 parents said that they were drinking alcohol on a daily basis to kind of cope during COVID. And as a response to this, in Australia, an Australian NGO launched this campaign, and I think it's really good. So it's like, our kids have been watching, you haven't been drinking alone. So it's just to kind of raise that awareness, that encourage parents to think about how their drinking can influence children's behaviours and towards alcohol. And I suppose they had a range of kids' pictures with, there's the milk, it's kind of like cheers, but it was quite hard hitting in one way, I guess, but it really caught the attention, and there was a lot of media around it, and there was a lot of debate around it, and it really did, I think, strike the right balance in terms of raising the awareness. And I guess the thing is that this happened in Australia based on, as I say, this survey results, which are quite similar to the reports that we're getting in Ireland around parental drinking. So so that's interesting to note. And then I guess a more targeted measure, like, there has been great work going on, of course, already for years with families and children of substance using parents. And Bernardo's is just, one agency that's been doing this work. And these vignettes here are actually real case studies from the Bernardo's Lorien project, which works with parents and children where there's problems with drugs or alcohol. And what they do is, I suppose, they hear the voice of the child, I suppose, and the child here is, nobody at school knows, sometimes I can't wake my mum up, or why is mum sad, I love my mum, why does she shout at me? So that's what the child is experiencing, I suppose, and can't put it into words, that it's connecting it with that mum has a problem with alcohol, or perhaps alcohol and mental health. And so what the project does, it brings the parents and child together, I suppose, in honest conversations, and helps them use targeted interventions to get to the root of the issue, and help develop positive and healthy coping strategies. And Bernardo's will talk more about their work with families in this regard. But so we would kind of say more of this kind of work, please. And this is great work, and for sure we could do it. This is a great example, I suppose, of a model of co-production where families feel engaged there with the process, and it's not just a kind of a paternalistic approach. So we do have the hidden harm strategy, and it's great that strategy is there. But I guess we would ask, how is it being implemented on the ground? And we would like to see perhaps like a public action plan, so that all stakeholders can see the actions and work towards them. And we would also feel that as part, or to go hand in hand with this targeted strategy, we need a campaign about substance use in the home and effects on children to raise awareness on a population-wide level. Because, you know, if these issues are left unchecked in the home, then they can become a child protection issue. But early intervention is key so that, you know, children and families can thrive. So we just made some recommendations in collaboration with the task force. And again, we would feel a whole of government approach should be taken to parental substance use problems and childhood diversity. Like children have a right to a childhood free from alcohol harm. So this is a children's rights issue. And we'd like to have an identifiable government official who has responsibility for this to develop and plan appropriate policies and services and who's accountable for it. And we would feel that the hidden harm framework requires more momentum and urgency, particularly in information campaigns, training, raising awareness with all professionals that work closely with children and families, and especially in light of COVID and all of the evidence that we've seen. We would advocate that drug and alcohol task forces should be assigned dedicated funding to support trauma-informed services to support children and families affected by this issue, and not only when parents are in treatment, but as a prevention and early intervention support for children themselves. And we would also like to see schools strengthening their collaboration who work with services with children and families. And I know even from visiting the Lorien project that a lot of referrals do come from schools, and some schools are really connected and in that way. But we would like to see this, you know, all schools should be doing this. All schools should be looking out for hidden harm, and there should be some sort of an early intervention service, and, you know, that flags that a child is potentially in trouble. And one model is a UK model that we've been heavily advocating for in Alcohol Action Ireland, and we've had some assistance from the Ombudsman in this regard also. And this is Operation Encompass, and it's an early intervention service that allows police to notify schools if a child's family has been involved in a domestic situation. Again, it doesn't necessarily have to be a child protection concern. It's just a kind of, are you okay to that child? The school knows that there's been something happening in the child's family and is keeping an eye out to see if that child or family do need any help or additional support. So the full report that this is based on is on the Alcohol Action website. And I guess all that's left to say is just thank you all for listening. It's really great to have the opportunity to share our report with you, and hopefully it will stimulate discussion and, more importantly, some action. And just to point also to our Silent Voices page on the Alcohol Action website, it's got a wealth of resources around the issue of problem parental alcohol use for both children and adults. So if anyone is feeling impacted by this, they can go on and see a list of supports for anyone that might be impacted. So thanks very much, and I'll hand back to Ali.
Great, thank you so much, Jennifer. So I'll just stop sharing slides there, and thank you for that incredible opening and very poignant as well, and really bringing to mind exactly what we're working on here.